Do I have to lose weight to qualify for bariatric surgery? I'm Dr. Barr, a bariatric surgeon in Dallas, Texas, and in short, the answer is actually no. Back in the day, many programs required patients to lose some percentage of their body weight in order to get surgery. This was previously thought to indicate that if a patient could do that before surgery, then it would be a good predictor of how they would do afterwards. This fell out of practice since it was found to be not an accurate predictor of how the post-op period would go. Today, some insurance companies require participation in a weight loss program or supervised diet for a certain number of months, but there's no actual body weight percentage or number of pounds associated with being in that program in order to qualify. Just proof that you're trying. Many patients have difficulty losing weight. That's why we're here, and that's why we're getting surgery. Some surgeons, however, do have patients follow a 2-week liquid diet pre-op. But again, there's not a number goal associated with that, and it's actually not about losing weight at all. It's about the liver. So the hope is that if we do this diet to shrink the liver of its sugar storage, it'll make it smaller so that the stomach is easier to get to, and therefore the surgery is easier and safer. Many practices don't require this because they plan up front to make an extra incision to place a liver retractor to hold up the liver during surgery. Lastly is a situation of very, very high BMI patients. Some surgeons or anesthesia providers might not be comfortable with performing surgery on a patient with a BMI over 70 or 80 and will want you to lose weight to make the overall risk of surgery less. Most surgeons that are specifically bariatric and not just general surgery performing bariatric have a much higher tolerance for operating on less healthy patients in order to get them the help they need. At our practice, we don't have an upper limit on BMI. We'll just make sure that they're as healthy as possible before moving forward. The focus on the pre-op period is on safety, not proving willpower. So if someone is making you feel like you have to prove your worth before surgery, question where that's coming from and maybe question that relationship as well. If it's not from the insurance company or for safety reasons, there's got to be a better way. Remember to like and follow for all things bariatric surgery. And if you live in the DFW area, you can schedule a consult with us at the link in the bio.